fellow learners. This is your mentor, Ray, your fact check buddy, joining you for another teaching and learning session related to your test preparations. Now, let's engage. So these are the two concepts that I'm going to cover in this video today, and it's going to be about uterine rupture and hysterectomy. So let's begin with our first functional concept. Uterine rupture involves spontaneous tearing of the uterus. Therefore, since it happens spontaneously, it's something that's very difficult to predict. And sometimes it just happens, and through the assessment of symptoms, your healthcare provider would sort of have an idea that it could be the condition that a pregnant patient is suffering from. Now, hysterectomy, on the other hand, is a treatment option for uterine rupture. And this is done to prevent excessive blood loss. When I say hysterectomy, that's a surgical removal of the uterus. And one of the effects of hysterectomy is that the patient would no longer have menstrual period. And definitely, their procreative ability could end after the surgery. So it simply means they may not be able to carry babies anymore in their wombs. And this has special implications, especially if you have Hispanic women as your patients. We know for a fact that among Hispanic women, within their culture, their children is what they consider as part of their wealth. Therefore, it's very important to consider that you have to explain to them, or you have to discuss with them about the things that could potentially occur. But definitely, before the surgery, it should be the surgeon explaining the details of what will be done to the patient and the potential complications. And it's very, very important that if the patient is unable to speak English, an interpreter is brought in for the patient. You do not use the patient's children, any one of them who knows how to speak English, because it is considered impolite for male within the culture of Hispanics to be talking about reproductive organs with the opposite sex. So they may not accurately translate the uterus as such. So they could sugarcoat their explanation and probably say a tumor will be removed from the belly rather than being more specific. That's why we have to be culturally sensitive to our patients. So let's try answering a sample question based on the superficial knowledge we've just finished with our two functional concepts. Let's see if it would help us get through some of the items. Here's the question: which of the following outcomes in a patient post-hysterectomy needs further evaluation from the nurse? And then you have here a multiple choice with multiple response type of question. Select all that apply. Slight bleeding 2 weeks after procedure, urinary incontinence, passage of stool from the vagina, feeling of fullness in the pelvic area, pain during sexual intercourse, and absence of menstruation. We just covered a little of this. It was just like a tip of the iceberg discussion. So it's very important that we need more of our functional concepts. But before that, let me share today's good news. Let me congratulate Francis Joseph Pilau from Our Lady of Fatima University, Valenzuela campus, who is now a USRN in the New York Board of Nursing. Just recently passed last January 18, 2022. And I'm so glad he sent me an email appreciating the study guide I prepared for him for free. So for those of you who would want to have a study guide on which one do you need to focus on before taking your test, please feel free to send me an email and I would definitely respond. So Francis appreciated that much. And so I'm so glad to congratulate him through this video. Okay. So for this year, I would like again to put another 100 nurses in our sponsorship and scholarship program to provide them free NCLEX RN application and review to help us achieve this. Just watch and finish the ads in our videos. So thank you in advance for doing so. Now, let's resume our discussion of functional concepts. So uterine rupture is manifested by sudden severe uterine pain. So if you have a pregnant client who is having sudden severe uterine pain, that should be a red flag, and that patient could be suffering from uterine rupture, and that is an emergency case. uterine contractions that doesn't stop. Now, the normal uterine contraction would depend on the stage of labor that the patient is in. However, if we're going to take a look at the range, it's going to be from 30 to 90 seconds. So if the contraction of the uterus could be beyond 90 seconds and the patient has yet to receive oxytocin, it is essential for the nurse to assess if the patient has taken an herbal remedy that could have led to the hyperstimulation of the uterus, like, for example, blue cohosh. Okay, so that's one area of assessment that we need to focus on. So next, regression of the baby. If the fetal heart rate is decreasing, that should be a cause for alarm. And then when the baby goes into fetal distress, they could either have a reverse mirror image of uterine contraction or a U or W shaped uterine contraction. Remember, the reverse mirror image uterine contraction pattern, fetal heart rate pattern rather, could be associated with late decelerations, and the U and W shaped fetal heart rate patterns could be associated with variable deceleration, which could be associated with cord compression. Now, whether the patient's having late decelerations associated with placental insufficiency or variable decelerations associated with cord compression, those two could mean that the patient is going into fetal distress. And then severe vaginal bleeding. So we have here the code SERFs. So if any one of this could be present, assess the patient further. So it requires further evaluation from the RN. So early detection is the key to treating uterine rupture. And the priority in uterine rupture is to deliver the baby within 10 to 40 minutes. Otherwise, hypoxia may result. Now, after hysterectomy, the patient will receive pain medication. They will be asked to stay in the hospital for 1 to 2 days, experience slight spotting until 6 weeks. So there's going to be slight bleeding. It's not a cause for concern. However, if the bleeding is as heavy as a menstrual flow, it needs to be further evaluated by the healthcare provider, and that needs to be reported. So resume sexual activity, heavy lifting, and usual activities after 6 weeks. So if this is a concern for the patient, you can confidently tell the patient that once healing has been achieved after 6 weeks, then they can engage in sexual activity. And then they may no longer have menstruation, but they would still be at risk for cervical cancer. Now, here's one thing that I'd like to highlight about the possible complications of hysterectomy. And this could include urinary incontinence, vaginal fistula. So when there is vaginal fistula, there is abnormal connection between the bladder or rectum and the patient's vagina. So you would notice that the patient could be complaining of passage of stool or pus from the vagina, or there could be foul-smelling vaginal discharge, or recurrent vaginal infection or urinary tract infection. And then there could be possible irritation of the vagina and the area between the vagina and the anus, or that's what we medically call perineal area. And then if the patient experiences pain during sexual intercourse, that could also potentially indicate the presence of a fistula. Vaginal prolapse could also result, and this is when part of the vagina goes out of the body. So how will you know that the patient could be having vaginal prolapse? So they could complain about feeling of fullness or heaviness in the pelvic area, and then they will have low back pain, bulging in the vagina, or there's going to be urinary incontinence or bladder infection, and then they could be experiencing difficulty of bowel movement, as well as difficulty or painful sexual intercourse, and then they would definitely have problems inserting their tampons. And last but not the least would be chronic pain. So if you notice, you have the code UVVC. Okay, so let's go back and let's try answering a sample question. Which of the following outcomes in a patient post-hysterectomy needs further evaluation from the nurse? The key to answering this question properly is to interpret the phrase needs further evaluation, which means those that are expected may not necessarily need further evaluation. So if you see the phrase needs further evaluation, you will have to focus on the potential complications that could be developing in the patient. So slight bleeding 2 weeks after the procedure, we said that slight bleeding could be expected for a couple of weeks. So we put an X, that is expected. Urinary incontinence, this could mean that the patient could be having a complication. Okay, so it could be associated with vaginal prolapse. Passage of stool from the vagina, so this could be indicative of fistula. Feeling of fullness in the pelvic area, once again, this is indicative of vaginal prolapse. Pain during sexual intercourse, this is indicative of vaginal prolapse. Absence of menstruation is gonna be expected, okay? Okay, so therefore, we put an X to items number 1 and 6. So I just hope you learned a lot for this very short video, direct to the point. So let's learn together. Send in your request to my email, mentor.raygapuz@gmail.com. So here's your mentor Ray once again saying, a functional concept a day keeps your RN fears away. That's right, NCLEX RN fears away. So if you love this video, please don't forget to subscribe, share, and hit the like and bell notification buttons. You can also share this to your friends, to your social media accounts. Please share it to those who need help. See ya in our next video.